wait. Recording in progress. Now we go. Yeah.
Okay.
Anorexia, starting on page 146 of our textbook. My story starts before Karen Carpenter was diagnosed with anorexia, so nobody had really even heard about it. I was a high school sophomore in a Quaker co-ed boarding school in Pennsylvania. My parents divorced, which led to a lot of moving drama and a feeling of abandonment. I loved sports. I was the only sophomore to play 3 different sports at the varsity level. I had never had performance anxiety during games because I never had anyone I knew watching me like other girls. I felt invisible, and I gradually became pretty physically invisible, weaker, and sick. I ended up in the infirmary with a bad bout of what I thought was the flu. My science teacher came to visit me carrying a cupcake. He told me he knew what was wrong with me. He said I had something called anorexia nervosa. I thought that was a fancy name for a flu bug. He wanted me to see me eat the cupcake. I adamantly refused. The school called my parents. My dad was living in England at the time and couldn't come, and my mom was in Texas. She came to visit me. I was sitting on the bleachers by the sports fields with my back to her. She said she saw me from the back and started crying. I don't remember much about that. From that point on, it seemed like a battle for decades to have a normal relationship with food. After a while, my body screamed to eat, and then I ate and became my worst enemy. I gained 40 pounds in a month. I disgusted myself. I had to regain control, so I was a failure at making myself throw up. I used laxatives. Never mind what I said before we started the movie.
Mhm.
Um, in college, sophomore year again, something about sophomore year, LOL. I was on 3 varsity sports teams again when I became very weak. I couldn't even walk to class. I dropped out of school and ended up in the hospital with Crohn's disease. Crohn's disease back then was not very well understood. I was told it was incurable and that I would always have it, and that it could end up with a colostomy bag. Yikes. I had several blood transfusions and I lived on steroids. Needless to say, it paused my use of laxatives. Food is necessary for survival, and unlike any other substance abuse disorders, you can't just abstain, you have to manage it. Antidepressants and talk therapy seemed the only way to do it. The therapist wanted to admit me to the Renfro Eating Disorder Center in New York. That was never going to happen on my watch. By now, I was in my late 20s and in a career as a golf course superintendent at a field in which I was a pioneer for women. A lot of attention was on me because I was one of the first in an all-male occupation. Okay, okay, Mary's going to come in a minute. In an all-male occupation. I was fighting the stigma that I couldn't succeed in it like a man, and I didn't need my colleagues finding out I'd been admitted to a center for psychiatric eating disorders. Antidepressants killed any libido I had, which I never understood since I never experienced it. I didn't know what I didn't know. I hadn't even had a relationship until I was 25. I had tried so many times to get off of antidepressants. We're reading about anorexia right now. I had tried so many times to get off of antidepressants only to spiral back into crippling depression. There was always this period about 3 months after getting off the medication that I felt supercharged and happy. If only I could freeze that feeling, but it never lasted. When I was in my early 40s, I read a book on balancing brain neurotransmitters by a famous doctor in New York who claimed to use natural supplements. I was desperate to get off and stay off of antidepressants because the side effects made me feel numb and exhausted all the time. I wanted this doctor to help me naturally get my brain on track and get off of medication. His book told all about how, with the right supplements, one could naturally achieve balance, or so I thought. I dropped over $4,000 to spend a day in New York City at his clinic, going through all kinds of brain scans and tests, only to be told that I was bipolar and I would always need to be on medication to ensure my depression would not become worse. My mother had taken her own life, and this doctor wanted to put me on 4 more medications! Exclamation point. I quit all medications cold turkey. I just thought feeling emotions again would be better in the long run than not feeling at all. I always thought I'd retire from my 30-year career as a golf course superintendent on my own terms, and I'd have a big retirement party and a nice pension. I worked tirelessly 7 days a week and holidays because that's the way it was. The love I had for the profession turned to increasing stress on my body and mind. I had no life outside of work. I began to get strange symptoms, joint pain, migraines, diarrhea, panic attacks, brain fog, and anxiety. I couldn't continue doing my job. The fear of everything in my life forced me to quit my lifelong profession. Anorexia is debilitating, and the fear and hopelessness led me to many modalities and systems to try to feel better. For example, EFT, dynamic neural retraining, etc. But it never helped very much. Somewhere along the way, I stumbled across the three principles. I found Chana Studley's books very insightful. I had stopped eating meat to reduce inflammation in my colon, and it helped me. But once I saw that it was just my stinking thinking that was causing the discomfort, I was able to gently introduce meat back into my diet, and now I can eat whatever I want, whenever I want, without problems. I was able to make this dietary change for my health without setting off disordered thoughts around eating. It's amazing. Food is now just a way to receive energy, not a tool to beat myself up with. Something has shifted in my thinking, and in this better state of mind, that old behavior just doesn't make sense anymore. What I found interesting about reading that was the visual of, I could tell that this story, page one, I'm sorry, that's the first page, and there's the second page, and it was going to end like it wasn't going to go on beyond these two pages. And I'm reading, problem, life, 40 years old, problem. And the very last paragraph, I found the principles. I can eat normally now. Goodbye. Just the visual of knowing that I needed to read all this to read our story. And I'm going, when's she going to start talking about when is she going to start talking about, when is she, right at the very end. I found the principles. I'm all set. Goodbye. I found that really interesting.
Yeah,
Yeah.
yeah, good.
Crazy.
That is interesting, Wendy. Yeah,
Yeah.
wow.
Yeah. All right. Who's got the book and wants to read Bulimia with Amy Johnson? And just for Mary's sake, you may not know Dr. Amy Johnson, or maybe you do, but she's a psychologist who found these principles, I don't know, 10, 15 years ago, whatever. And she's developed quite a practice using the principles with her own patients, but she's also become quite a teacher of coaches who want to be able to teach this well. She's got quite a dynasty going on, whatever. So it was interesting to see that, she shares her story, which she's very open about when you listen to webinars with Dr. Amy Johnson. She's got a book called The Little Book of Change, and it talks about habitual thinking and so forth. So she's pretty well known in this circle. So this will be a good story. So who's reading, Elaine or?
I will.
Elaine. All right.
I always had this high level of anxiety for as long as I can remember, which started around age 5 or 6. Twitches, nightmares. I was just an anxious kid. As a kid, you have no idea that your thoughts aren't true. When I was around 22, I was diagnosed with panic disorder and generalized anxiety disorder. I was having a lot of very acute panic attacks. I did some therapy. I tried Xanax, but got super anxious about what this drug was going to do to me, so it didn't help. I was smoking heavily at the time, and so I decided to quit smoking. And I started to hear that smoking was a way to control your weight. Hadn't ever even bothered by my weight, but I got nervous that I would gain weight if I stopped. So I started dieting and working out regularly. Looking back, I can now see that my mind took that and made it the new obsession. So I would diet and not eat and count what I was eating with a lot, which led to a lot of tension, a lot of anxiety, and a lot of deprivation. And so my beautiful, healthy brain tried to protect me from that and would have me eat a bunch of food. At first, they weren't even real binges. It was just I was trying hard. I was trying hard to diet. So if I ate, it felt out of control and was such a horrible feeling. So then my mind would suggest I compensate for that and the next day I would eat even less. And this became 8 years caught up in a cycle of emotional eating. Some days I would wake up and they would be okay days, and other days I would wake up and it would be a day when I wasn't going to eat, and I would exercise a lot. Some days were starvation days, and I would push myself to the limit, and other days were binge days. It wasn't so much a decision, it was more of a huge swing from one to the other. If I woke up and couldn't do the starvation thing, I would swing and have a massive binge. I felt very out of control. Once it took hold, it swept me away with it. I felt like I didn't have any choice, and I had to go along with it and hoped I would wake up from it at some point. Then a binge day would turn into 3 or 4 solid binge days. It was such a powerless feeling. I worked in an office in downtown Chicago, and I would get an uncomfortable feeling if someone looked at me wrong, and I'd feel like I had to escape the feeling. I wanted to run and buy a bunch of food every time I felt uncomfortable. But then the thought would come, no, you can't. This is starvation day. So that was more pressure, and no one knew. I had so many rituals to discard the evidence and compensate for the effort and the time and the energy that this took. I was starting a career and I got married, and I remember the relief when I would binge. I then started to get relief from planning a binge. So many lies and excuses. I'll go run that errand. You stay home, honey. I promised myself that I would stop. I had so many plans to stop, so many times of throwing food away. It was so demoralizing. I couldn't sit in a feeling. Eventually, I did go to therapy and was diagnosed with binge eating disorder, bulimia. I did DBT, lots of CBT, and I went to a very well-known eating disorder clinic. There was some helpful things along the way, a kind therapist, for example, but nothing lasted. It didn't make any impact on my habit. They asked a lot of questions and wanted to focus on things like being new in a career or newly married, as if those were causing it. But that never made sense to me because these were good things. I started to look into all kinds of self-help. I tried meditating, hypnosis, energy healing, but I always knew it was like a patch to cover up that feeling of being screwed when it happens again. I did learn that my brain was doing its best to survive. It was actually working very well doing what it thought I needed for survival.
Yeah.
But on top of all that was all the thinking I have this disgusting habit. I'm horrible, I'm powerless, I'm weak. But when I saw that it was my brain, a lot of the painful thinking fell away. Around this time, I had heard about the 3 principles that we were all sitting in the middle of a perfect mental health, and that we are always feeling our thinking. I started to see that this isn't about me. It's just thought coming and going. It's just feeling coming and going. There was some kind of energetic shift that followed me to be in discomfort in a new way. I started to see through all that thinking and that it wasn't me. To be able to notice thought just as a thought, that it's not true and it doesn't have anything to do with me. I mean, I could get relief from planning and plotting my next binge, but I didn't have to listen. I didn't have to do it. 3 principles teacher, Dr. Mark Harward, showed me that if I was getting relief from thinking about it, I didn't have to actually do it. As I saw that I could be in discomfort and it didn't mean anything about me, the whole habit turned into slow motion. I didn't push it away anymore. I could be with it. As I saw things differently, I was able to feel what was arising, and it just became obvious that I didn't have to act on it. Understanding the principles showed me that thought comes and goes, and I didn't have anything to do to fix it. I started to see my binge habit was actually a solution to a fear problem. From that low level of consciousness, binging gave me relief. But as my understanding and consciousness got better, it no longer made sense. The behavior still showed up occasionally for a while, but I just didn't feel the same about it. I didn't beat myself up about it, and that is huge. The principles helped me see that the slate just cleans itself. If I overate, then it was done, unless thought carried it through.
Time.
As best as I wasn't following through on those plans, and so I was always in a fresh new moment. My mind had carried this fictional story about who I was and how to handle it, and it just wasn't true. It's been 12 years now. I don't need to manage my food anymore. This freedom is everything I was looking for.
Yeah, that's really good. Hannah often will say, because I'm in a lot of groups with Hannah through the week, myself, and she often repeats this. She said, if you have a full and happy heart, it doesn't occur to you to do things that will hurt yourself.
Mhm.
Oh, I like that. Yeah. Oh,
Mhm.
that's
Living from a
wonderful.
full and happy heart. And I know Mary and I we think alike when it comes to God stuff. And I know that there's some sort of a scripture from the Psalms that says, or Proverbs that says something very similar. But yeah, like when you're content, like Sid calls it contentment, it doesn't occur to you to do something that's self-harming or not in your best interest.
Isn't
Or
that
somebody else's
interesting,
best
right?
interest. Yeah,
It shows you like levels of consciousness, right? Contentment
Mhm.
is at a higher level of consciousness, and we just don't go in that direction of thinking against ourselves or against other people.
right, right.
Yeah. Mhm.
And what I love, as you know, being the nurse that I am, a level of consciousness, I have a full and happy heart. Unless I'm hungry, unless I'm lonely, unless I'm tired, right? Unless I'm
Mhm.
angry. So my level of consciousness goes down with some things that are very easily addressed. Go eat some protein.
Mhm.
Call up your brother and tell him that you're upset with them. Don't hold on to the anger. If you're lonely, pick up the phone, call. There are things you can do. Those aren't strategies in the three principles world, but when these things happen, now I know that my thinking is being impacted by hunger, angry, lonely, tired. It's not just emotional existential stuff. There's something very practical. Well, no wonder you're in a crabby mood. You haven't eaten in, 8 hours or whatever, that kind of thing.
Mhm.
Yeah.
Mhm. Yeah.
You know what I love is how we feel our thinking. I mean, we
Mhm.
are designed to feel our thinking, and that's our inner GPS. That's what lets us know when we're off base. Like I got perturbed this morning in my exercise class at a woman, and I noticed I'm thinking, what a bitch. She was like hogging all the space, totally in her own world. And I laughed to myself because I realized, my gosh, Lori, you just thought that? That is hysterical. And my whole mood changed.
Mhm.
Like being aware of where we are. Yeah, we can have some major
Mhm.
swings, major mood swings.
And you know what
Yes.
I heard in that
Holy.
too? What I heard in that too is that woman's a bitch. And then all of a sudden your aperture opened and you were like, oh, maybe she's having a hard day. Maybe I'm having a hard day. Maybe, like if what the principles has taught me is that she's a bitch. That's what I used to say. Well, it's true. And I'm a smart person. I know a bitch when I meet one. Right. And now I know that every thought is not a complete piece of truth. And it's dependent on, whatever it's dependent on. And some of it's dependent on hungry, angry, lonely, tired. So there's this part of it. And then there's this part of it. There's the consciousness level. And then there's the thought that everything I think and I'm able to retrieve in the moment is accurate and true. And now, thanks to Sid and our buddies, there's always that little half inch of space that says, well, just look in a different direction. You know, don't hit her now. Wait.
Yeah, and I love that. It doesn't come through words or a book or a teacher, or it comes through our own life experience. So we read
Mhm.
stories like this and we talk among ourselves, and then we have an experience like, thinking this woman is shocking space. And we see it in real time.
Yeah.
We see our own experience in real time, and we can laugh at ourselves and realize we're no different than anybody else.
Mhm.
But
Mhm.
the person who thinks I'm a bitch believes it. Like
Mhm.
Right.
that's who Lori is.
Mhm.
Um, they don't what's lacking for, most people, I almost said people who don't know about the principles, but there are people who don't know about the principles and they live a really contented, beautiful life. However, I needed to learn from Sid and others.
Yeah, that's a really nice way to put it. That's
Yeah.
a nice way to put. We have that kind of a similar saying in Alcoholics Anonymous. Other people know how to drink. I unfortunately don't, and I had to come here to get help with it. So
Mhm.
that's what so there's a similar kind of a thing of a graciousness to say, not everybody's abuses alcohol. Not everybody that, drinks is cuckoo. Some people drink responsibly. I personally couldn't do it. And I was very happy for the steps that I learned. But so that's a very interesting, I really like that. Not everybody needs it, but I'm glad I found out about the principles too.
Mhm.
Yeah.
Mhm.
Yeah,
That's good.
yeah. All right, Mary, you want to go or should I go with body dysmorphia?
Do you have the book, Mary?
I do not have the book.
Yeah. So you go for it, Lori.
All right, body dysmorphia, Maria Morgan in the UK. As a young child, I didn't think about how my body looked to other people. I simply enjoyed being in my body. I loved dancing wildly to jazz, snuggling in my mommy's lap, eating delicious food, feeling the warmth of the sun on my skin as I played in the garden, and taking in the scents of summer flowers. Life was a magical, sensual experience. But at some point, this powerful way of inhabiting my body started to change. Lots of messages from different sources reinforced one another until three key ideas took root in my mind. Indeed, they embedded themselves so firmly that it would take another 30 years for them to be dislodged. These ideas were as follows. The most important thing about being female is how your body looks. Wonder where she got that from, right? There are rules about how your body should look, and your value is derived from the extent to which your body conforms to these rules. Isn't it amazing, the things that we concoct that look real? You cannot be happy or get what you want in life, including love, fun, and pleasure, unless your appearance meets certain criteria. Given these ideas looked true to me, it was no surprise that I went on to devote an enormous amount of time and energy to trying to make my body match up to the ideal that I'd unwittingly formed in my mind. 3 decades of various kinds of disordered eating followed. There were long periods of highly regimented under-eating, during which my periods stopped and I barely had the energy to get through the day, interspersed with times when I couldn't stop eating. And I watched with alarm as my weight kept going up, shattering all my dreams of being attractive and therefore able to enjoy life. And even though there were phases in which my eating and body size might have seemed relatively normal to an observer, the preoccupation with my appearance was never far from my mind. I went to my first 12-step Overeaters Anonymous, OA, meeting when I was 17 years old. There I was told that I had an incurable disease. Well, there's a lot of belief around incurable diseases, huh? That was the bad news. The good news was that if I did what the people at the meetings and their literature told me to do, I could enjoy a daily reprieve. However, if I got cocky and didn't work the steps, I would relapse. It was also strongly suggested that I was addicted to processed sugar and white flour. And it was hard to object to that when I often found myself unable to stop stuffing cake into my mouth. The sense of solidarity and camaraderie at OA meetings was wonderful. It helped me enormously to express my thoughts and feelings in a largely non-judgmental atmosphere. Without realizing it, the love and acceptance of the group chipped away at the belief I'd had that my worth and well-being came from looking a certain way. After all, I experienced serenity during meetings, and my contributions seemed to be valued by the group regardless of my body size. The ease I felt in a supportive community served as proof that it wasn't necessary for my body to fit a societal mold for me to experience well-being or be worthy of love. But that was not the overt message I was given. I was not told that love was the answer. Instead, I was told that if I didn't keep doing all the things, I would go back to my old ways. This left me with the impression that fear was necessary to keep me in check.
Yep.
So my beliefs about a woman's appearance remained untouched, and I learned that I couldn't trust myself. As a result, my painful relationship with food and my body persisted. As my 40th birthday approached, I had become fed up with the endless repetitive binge restrict cycles and the tedious preoccupation with how my body looked. I was also tired of promising myself that I'd change my behavior only to find myself doing what I'd sworn I wouldn't do not long after. I felt stuck. I'd read a lot of books about body image and eating, but despite all that knowledge, I still found myself unable to break free of the unhealthy habitual patterns. I needed a new approach. Finally, I was ready to think the unthinkable. What if the beliefs I'd held onto so firmly all my life weren't actually true? Around this time, I was drawn back to the work of Dr. Amy Johnson, who I'd stumbled across when searching for a solution to binge eating for the umpteenth time. Amy was the last chapter we read.
Yeah.
I knew there was something helpful and important for me in what she was saying, even if I rarely had any idea what she was talking about. Through Amy, I found a wonderful teacher called Rohini Ross, and in her kind, loving presence, a lifetime of conditioning melted away. Rohini's sharing of the teachings of Cindy Banks helped me see that my suffering was coming from my relationship with my contaminated thoughts, which had distanced me from my essential nature. I realized that I'd been totally wrong. My worth did not come from the extent to which my appearance conformed to certain arbitrary standards. My value came from the life force running through me, a force which was creative, loving, and wise. I clearly saw that my well-being came from experiencing the magnificence of that force more directly. It wasn't contingent on a number on the scale. And I realized I'd been wrong about beauty too. Beauty is what we see when we view life through the eyes of love rather than the filter of judgment. Boy, is that a true statement. As a result of these insights, my preoccupation with my appearance dissolved and eating became an enjoyable, practical matter once more. Nowadays, it feels like I have returned to the magic of my early years. Without the constant hum of anxiety about my looks, everyday life feels lighter and easier. I'm able to be more of the parent and wife I want to be, and I have the time and energy to try new things. I now see that all the wonders of the world, which I thought I needed an ideal body to access, are available to me already. Never has it felt so good to be wrong.
Wow.
I love that last line. Yeah.
I love that. Without the constant hum of anxiety about my looks, the quiet mind, right? Everyday life
Mhm.
feels lighter and easier. I'm able to be more of the parent and wife I want to be, and I have the time and energy to try new things. I now see that all the wonders of the world, which I thought I needed an ideal body to access, are available to me already. Never has it felt so good to be so wrong, or to be wrong. It's good.
Mhm.
All right.
Keep going round robin. Your turn, Wendy.
Yep. Shall I continue? Yep. All right. This is Anorexia by a woman named Belle from Switzerland. I first met, well, I don't know who this is about, so never mind. Anorexia, Belle, Switzerland. I first met Belle in May 2022. This is Hannah talking. She initially came to me due to personal troubles, which I soon discovered to include anorexia, phases of depression, anxiety, and suicidal ideation. Very soon after we began our sessions, she joined us in our school based on the three principles in order for her not to be under constant pressure from the state school system and for her to relax on a deeper level. In our sessions, we worked on how she could understand her thoughts on a new level and on discovering what influence her state of mind had on her thinking. Since she had joined the school, she has heard about the levels of consciousness, her innate health, about well-being being the most natural state of mind, and about the connection between thought and feeling on a daily basis. She thrives in the school's atmosphere and is becoming more and more aware of herself as an inherently healthy being who has hiccups on the path. Belle is 14 years old. Here are her words. I have a very privileged life so far. I live with my parents in a beautiful big house. I go to a private school, and I have everything I could possibly wish for. Even so, I have probably experienced an above average share of relatively difficult circumstances. I have been in and out of psychological practices since the age of 4. One of my psychologists once stated that all of my problems stem back to when I was 4 years old. That is where I have decided to start my story and how my life has been impacted by the three principles from there. I was a child who was always prone to overthinking. I used to think about things that, according to developmental psychology, should not have been any concern to me at all yet, but I still thought about them, wondered about them. I cared little what psychology considered age-appropriate thinking. I asked all those questions, thought all those thoughts. I remember being about 4 years old, lying in bed and wondering what it would be like to be dead. I really wondered what would happen when I die, imagining my pillow being pressed to my little face until I would eventually die. It wasn't that I was suicidal at that age, I just really wanted to know. Life was full of joy for me, and yet I wanted to understand death. I spent hours thinking about what my life mission could be. My mom always told me that everybody was born with a mission, so I really wanted to find mine. This question was just as fascinating to me as death. I have also always had a kind of a sixth sense that allowed me to sense what I thought others around me sensed. I loved observing people, analyzing their behavior patterns, and trying to understand their way of thinking. My life was quiet, not silent, but calm. My never-ending energy kept everybody around me, including myself, busy. I was nosy, attentive, always wanting to try out everything, and at the same time, I was often in la-la land, daydreaming away. At the age of about 8, something changed. I don't know what it was. I just noticed that it was. Everything appeared to having a new, unknown effect on me. I started despising myself and at the same time being fascinated by myself and the influence I had on other people. By age 11, the despising part grew bigger than the fascinating part of me. And that is how one domino tile gave an impulse to the next, and soon the tiles were tumbling. It began slowly, kind of like sneaking into my life. I only noticed I had lost control when it was already far too late. When I started to purposely throw up after mealtimes and eat less and less, I was not yet aware of the ball that I got rolling. At a certain point, I realized I had to tell my parents. It hit them hard. They had no awareness of their little girl being in such a bad way. At the time, I was still in an artistically inclined private school. My state of mind, or others would say that my mental health deteriorated. The following 2 years brought depression, anxiety, panic attacks, sleeplessness, restlessness, and a bunch of psychological diagnoses. I encountered countless psychologists and psychiatrists. I was even admitted to the psychiatric ward of the local children's hospital twice and spent some time in their clinic. First, due to my anorexia, and a second time due to an acute suicidal threat. I was put on some very heavy medication that would put me into a near unconscious state for hours. I was at the end of my forces and didn't know what to do anymore. And as if this weren't enough, I met a boy. Everything went really fast. We had only known each other a few days when we got together. One day, I was under severe medication. He took advantage of the situation and had sex with my defenseless body. So I had a desecration/rape to add to my list of ailments. One more thing added to non-ideal circumstances. When I met Fenella Blockage, I did not really want to talk anymore I did not really want to talk anymore at all. Too often had I found myself sitting in an unfamiliar practice of some kind, being asked to speak about my problems. But this time everything was different. She didn't ask the same question that I could have answered in my sleep by that point. She seemed to be really interested in me. She didn't wish to hear about my problems, my past, or my diagnoses. She wanted to hear about me. She didn't want to analyze me, take me apart, give me more drugs. She somehow just wanted to be there with me. Fenella never asked me to share details about my story. It appeared to me that she trusted that I would tell her what she needed to hear once it would come up. She trusted that I would speak about whatever was needed at the time, allowing my thoughts to unfold at their own pace, weaving a carpet of feeling. With time, I understood how deeply connected to my sense of well-being and my thoughts. Wait a minute. With time, I understood how deeply connected my sense of well-being and my thoughts were, and I also understood that I didn't have to take every thought as seriously as I had done. I could just be, rather than always overthink everything. This opened up a whole new world to me. And then one day I understood, like really understood, that I cannot be broken because I am pure consciousness. I understand that I'm only ever experiencing the content of my thinking or myself before the creation of the thought. Now that is a new way of living life. I still have a lot to deal with. My circumstances are what they are, but today I can honestly say that I see things from a completely new perspective, and thus I respond to circumstances in a new way. I have understood that my thoughts can be my greatest enemies and simultaneously my best friend. Whether I make them friend or foe, it's down to me and my state of mind, my connection to who I really am. Belle is still in our school. She's a wonderful coach to other young people who are new to the school, sharing what she's understood about the nature of thought and the nature of resilience. She still struggles with, she is still struggling with building up her weight. So every now and then we will find her somewhere shivering. But then she'll smile and gladly take out the hot chocolate we offer her while stating, a hot chocolate for my cells and one for any destructive thoughts that might still have hover around. Maybe they will calm down just as my shivering cells. She shows more and more of her joyful nature as time goes by.
Yeah. Hmm.
It's an interesting addition to the book.
Yeah.
Yeah. You ready for the next one, Elaine?
Yes. Binge eating, a case study by Elaine Hildes, UK. Jane came to see me because she'd just been diagnosed with pre-diabetes. And if that weren't upsetting enough, she had also been told she had binge eating disorder. She was confused and upset. Upset because of the dual label and confused because until a few months before, she'd been at an average weight and happy with life and had never had issues around food. But food issues are never about the food on the plate, but how you think about the food and yourself. When we talked, Jane told me that she hadn't dieted before her wedding because she was happy with her appearance. She didn't eat many sweet things because her family had a history of diabetes, and she'd been taught to be careful not to overeat chocolate or sweet desserts. It all went wrong, she said, when she got back from her honeymoon. Before her wedding, she left one job and started her new position after the honeymoon. The new job was in an open plan office and consisted mainly of women. They were all nice, she told me, and she was enjoying her new responsibilities. I asked her to run through what she ate during the day, and everything she listed sounded fine. But clearly, this wasn't the whole picture. And what else? I asked. And then the full story came out. Jane had lived with her husband for a few years before they married, and they had a good relationship. Her husband was easygoing and kind, but he really instigates anything. Now he had suited Jane because she enjoyed organizing time, and they joked that she was the family social secretary. So what went wrong? Jane told me that on Monday mornings, the other women in the office would talk about how their partner surprised them with a weekend away, or how their new love interest whisked them out somewhere fun and exciting. Jane enjoyed her weekends, but felt increasingly envious of these trips. She started to resent her husband And where she had enjoyed the way he went with the flow, she now thought of him as lazy and unimaginative. She knew her husband was worried about her getting diabetes, and she said that whenever she felt upset with him, she went to the vending machine in the cafe. And this was several times a day. She would buy an apple or something small from the cafe to take back to her desk to eat, and at the same time fill her bag with bars of chocolate from the machine that she'd then take into the toilets and stuff into her mouth.
Mm.
Classic binge eating. I asked her why she didn't ask her husband to organize something rather than punish herself. But until then, she hadn't seen this as self-punishment. She thought she was punishing him. She said that she shouldn't have to ask him to arrange things. He should just do it. And when she thought like this, she ate to punish him because she knew he would worry. She wanted to point at her body and tell him he'd done this. Unlike bulimia nervosa, binge eating isn't followed by forcing yourself to be sick or any kind of purge. So the sufferer continues gaining weight. Generally, binge eating happens at a time of stress. In 2007, Harvard published a survey that showed that binge eating is the most common eating disorder is prevalent among teenagers who are stressed. Sufferers eat like this to shut down their thoughts. No one binges because they want to. They eat too fast to enjoy what they're eating, and often feel upset and ashamed after binging. But when they experience unpleasant emotions or unwelcome thoughts, food seems like the solution. However, as with every addiction, the solution becomes the problem. They frantically stuff food into their mouths and don't stop until it is all gone. This, in effect, anesthesiacs their thoughts so that they feel numb until they stop. But then they are swamped with thoughts and feelings about how ashamed they are and feel wretched. It makes sense to engage in this behavior when it seems the only way to shut down intrusive thoughts is to eat or drink too much. And the way to combat this type of eating isn't to put someone on a restrictive diet or give them bariatric surgery, but to help them to understand the role of thought. When Jane realized what she was doing, she could address the problem. She had an honest conversation with her husband and told him why she'd been behaving the way she had. He thought she was happy making their social plans, and it had suited him to sit back and go along with whatever she wanted. But he committed to making more of an effort in the future. And Jane committed to noticing the type of thoughts she had, realizing her feelings of upset and anger weren't coming from her husband, but from her thoughts about her husband meant that she could regain a sense of ownership over her eating. When she felt compelled to visit the vending machine, she stopped and asked herself where she thought this feeling came from, and had to admit that the upset didn't come from her husband because he wasn't even in the room. Before our sessions, when she left her husband to go to work, they were both in a good mood. And then she returned home sullen and angry. She saw that this resulted from her thoughts during the day. As soon as a colleague mentioned something Jane was envious of, her thoughts turned to how useless her husband was and what a mistake she made. But now, when the familiar type of thought came to her, Jane stopped and asked if this were true. She let go of the angry thought and reminded herself of what she loved about her husband. She'd seen how it is possible to have loving feelings when you have angry thoughts, but how easy it is to feel happy when she made room for a new thought. The last time I heard from Jane was when she emailed me to tell me her husband was taking her to Paris for the weekend, and she was staying away from croissants.
That's good.
Great last
Gee.
sentence, huh? I love that.
That's good. Binge eating. Never mind.
Mm-hmm.
We have time for one more. Should I do a conversation with Dr. Rani Bora?
Yeah, we're so Mary, this book is divided into diagnostic categories. So we just finished the eating disorders one. So at the beginning of a new section, it's the first entry is from a provider who works in this area of this disease, this whatever the disorder is. And this one's going to be mood disorders. So this is a psychiatrist that Hannah records the conversation that she has with a therapist in eating disorders, which was whatever, and now mood disorders. And then, so then this is just a conversation between the author and the therapist who says, now I see the wisdom of bringing the three principles into my practice. And then the rest of that chapter is stories of people with mood disorders. So that's kind of how the book is run. So, yeah, we have about 12 or 13 minutes. This is a long few pages from Dr. Bora, but Lori's going to just read as deep as she can before we quit at 2. Oh, wow, it's very long. Yeah, we won't finish that one today.
We'll do some of it unless
Yeah,
there's something
definitely.
Yeah, is that good?
Yeah.
And Mary, I don't know if Elaine knows, but Wendy and I met Dr. Rani Bora at Viva a few months ago
Yeah, we did.
in
Yeah.
Spain.
Oh,
Yeah, we met her in person.
This therapist. Yeah.
Yeah. So, mood disorders, a conversation with Dr. Rani Bora, MBBS. That's interesting. I thought Rani was a psychiatrist.
She is.
Oh,
But
okay.
but she's in a different country, whatever they call it, right?
Yeah. She's a fellow of the Royal College of Psychiatrists, author, and mental wealth coach. She calls it mental wealth. And Chana Studley, the author of this book, says, when I was doing my research and looking at the DSM, I noticed that many of the same symptoms were showing up in all these different diagnoses.
Mary,
I've also,
Mary, do you know what the
great,
DSM is? Mary, do you know what the DSM is? Okay.
what a great realization she had that the same symptoms are showing up across the board. I have also noticed a lot of comorbidities. Could you talk about that from the point of view of a psychiatrist? When you're reading with a patient, how do you give someone a diagnosis if so many of the diagnoses have the same symptoms? What a great question. I can't wait to read what Rani Bora has to say. And she says, that's a great question. What I was taught as a psychiatric trainee doctor was that when a patient is presenting with some kind of mental health symptoms, the first thing we need to do is rule out an organic cause, meaning a medical problem. Okay. Maybe there's some kind of delirium or other physical health abnormality going on, which is why they are presenting that way. If not, then it's more likely to be psychological. Basically, we will try to exclude the organic cause, and once we have excluded an organic cause, we invariably come to the conclusion that it is possibly a mental disorder. I was trained to exclude from the top down or from the most severe end of the spectrum. Imagine the more severe forms of mental health conditions such as schizophrenia, schizoaffective disorder, and other forms of psychoses are at the top. People with these diagnoses can also present with low mood, anxiety, disordered eating, and other symptoms of ill health alongside their main diagnosis. It doesn't mean that they have comorbidity. For example, another clear-cut diagnosis. Sometimes people can present with symptoms that can fulfill criteria for, say, schizophrenia, as well as for clinical depression or anxiety disorder. The main thing is that people need to fulfill the criteria for each diagnosis, be struggling with their symptoms, and there needs to be an impairment of their day-to-day functioning. Comorbidity is quite common in the field of mental health. Anna says, okay, so once you have picked a diagnosis, is there really a need for different kinds of treatment if many have the same symptoms? I'm aware that the medications may be different, but if everything is coming from prolonged stressful thinking, wouldn't just one kind of treatment be the answer?
That's a really good question, isn't it?
Great
Mhm.
question.
It's a
Great
really
question.
good question.
And Rani Bora says, here's the honest response. The most commonly used psychiatric drugs are antidepressants, antipsychotics, mood stabilizers, and sedative hypnotics like zopiclone and benzodiazepines. Someone can have a diagnosis of schizophrenia and end up with all these different drugs. Or someone could have a mood disorder and end up with these same drugs. The drugs are not a cure for mental illness. They can help alleviate distress and calm the mind for some, but they won't cure the overthinking or change the firmly held beliefs. They can help clear a busy mind, and once the mind settles, the person might be able to engage in therapy or coaching to help shift their perspective. However, people do experience tolerance, meaning at some point, the medications stop working and they may need to keep increasing the dose or have more medications added in order to have the same impact. A mind at peace will not experience what we call mental health symptoms. A disturbed, busy mind will experience symptoms of mental ill health,
We just said that.
Mhm.
right?
What was it? A happy, full heart will not, right? A
Yes.
mind at peace will not experience what we call mental health symptoms. A disturbed, busy mind will experience symptoms of mental ill health. It's another way of saying it.
Mhm.
Right.
Yeah. All right, sorry, go ahead.
Beautiful. Chana says, amazing. Thank you for that clarification. What else have you seen? Ronnie answers, I have worked as a consultant psychiatrist on an inpatient psychiatric rehab ward and also as a community general adult psychiatrist in the NHS, National Health System in the UK. Something I have noticed is that the longer people are with mental health services, they can be at risk of having more and more labels placed on them as their symptoms change over time, or they present with more symptoms of ill health. Boy, oh boy, this chapter is just brilliant, right? So they might start with one diagnosis, and this can shift over time. For example, they might have been diagnosed with schizophrenia by one psychiatrist. And then later on, another psychiatrist may take that person's history and say, oh, that's not schizophrenia. That's actually a drug-induced psychosis or schizoaffective disorder. Or they also have a mood disorder or a personality disorder. The interrators reliability, the extent to which two clinicians agree on a diagnosis when presented with the same clinical picture is highest for neurocognitive disorder like dementia and lower for other conditions. Wow. Chana says, interesting. Could we talk about medication for just a moment? A lot of research says that drugs aren't that much more effective than a placebo, but people often say their drugs are helping them. Am I right in thinking that what they're actually doing is blunting their feelings and therefore they are not curing anything? Ronnie says, we have not found a medication cure for what we label as mental illness. The chemical imbalance myth has been busted. Thanks to the work of researchers like Professor Johanna Moncrief. Some people say the medication helps them and might say they are not experiencing any side effects. And there are people who mention feeling numb or like a zombie. When people are struggling and are fearful of their thoughts, feelings, or other experiences, they might find the numbing experience of psych drugs helpful. Antidepressant research has shown that antidepressants might have more of a placebo effect, especially when it comes to mild and moderate depression, meaning people can feel better because of the placebo effect rather than the minimal drug effect. I think this is good news because what it is pointing to is the power of mind and the power of thought. If we take something and we believe it is going to help us, the drugs can work because of the positive expectations, but the placebo effect does wear off after some time. If someone believes in the chemical imbalance myth and thinks they need to carry on taking the antidepressant for the rest of their life in order to function, well, they will need to carry on taking it. If someone believes the medication has helped them but they don't need it anymore. They will try to come off it. And as long as they get help from someone who knows how to de-prescribe safely, they may be able to come off it safely. Also, another thing that is very important, people often say, I was not sure the medication was doing anything, but I tried to come off it and then I felt worse. So I guess it was working. Yowza. So we got 3 more minutes.
Yeah,
You know what?
I'd-
Can I just read to the bottom of the page before everybody goes? Wendy wants to say something though. That way we can start on a fresh page next time. But you
Well, I
wanted
was-
to say something.
I was hoping we could take the 3 minutes to talk about the chemical imbalance myth. But if you want to
Okay.
start on a fresh page, we can do it that way too.
No, we don't have to. It's just, I'll make a big mark so that I don't miss it when we come back to it.
Yeah.
Okay,
But
I
yeah,
started.
that
I'm good.
chemical imbalance myth is just so prevalent. My husband is, as you know, he's becoming a life coach, and he just got a certificate the other day online in neurobiology or something. Like he was able to study what the amygdala does and this does and that does. I have no need to tell Jeff, oh, that's not part of that's not true. Part of that he's on his own journey. So I don't, but the other day he said something about chemical imbalance. And so I said, well, I said this, so I sent him some of the data points about the fact that the chemical imbalance thing has been debunked, and how it started. So I just find that whole thing so interesting that you can still read textbooks today in nursing and doctoring and wherever that say there's a chemical imbalance. Like it just won't, it's an urban myth that won't die, but yet it's been debunked. And Hannah might have talked about it in the early part of her book, how it actually came to be, the chemical imbalance framework started with, Elaine, you're nodding vociferously, so correct me when I'm off the beam here, but that it was a way of explaining more easily to people that something was wrong. They had too much cortisol. They had too much, like their hormones were overactive because they were scared, and so they bit their fingernails or whatever they did, or they got depressed. So just use the word chemical imbalance, and then the drug world, what do they call those things? Not drug,
Pharmaceutical.
pharmaceuticals took that, and their salespeople said, that's a great way to explain why they need Wellbutrin or why they need Zoloft or why they need this or that, is because they have a broken brain that they don't have the right chemicals like you and I do. Some people just don't have a brain that works well. So they'll have to be on these medications. Cha-ching, right?
Yeah.
And so, but the nice thing is that a lot of these, like Hannah and whatever, will say this was a misunderstanding that took root and took off. But there are many doctors who still think that there's a chemical imbalance, and they're not trying to tell people that for cha-ching reasons. They just think they're misinformed.
Yeah.
So there are many pharmaceuticals that are misinformed. They're going on data that doesn't really exist. So it's just so interesting to know that there is been very solid scientific data to prove there is no chemical imbalance. They've done, take this medicine and the chemicals stay the same or whatever. Like they've done studies to show there is no chemical imbalance. It's not like a 3 principles person says, oh, that's full of crap. No, it's head to head
Documented,
real
yeah.
research. Yeah.
Yes.
Isn't it great having the name of the person? I never
Yeah.
heard of, I've heard a lot of people in the 3 principles world. Bill Pettit, the psychiatrist, would also say there's no such thing as
Oh
a
yeah.
chemical
Oh,
imbalance.
there's a wonderful book out there called I'm not going to be able to remember the name of it right now, but it's by a British journalist who really goes right through every scientific study talking about, you know, the way that we've been misinformed about that and many things about like the story of the DSM,
Mhm.
you know, wonderful stories about a bunch of doctors sitting around a table going, yeah, that's a good one to put in the DSM. I had 5 patients with that last week. And oh, don't
And
put
all
that,
men, they were all men who
all
created the
men,
DSM.
and don't put that in the
Oh, boy.
DSM because I do that. So don't
Yes.
put that in there.
I have
Like,
to go, guys. Someone's waiting.
all right, bye. Like
Bye.
no science at
See you
all.
next week, Elaine. Have a great
Next
week.
week. You
Bye,
too.
dear.
Bye.
Like no real science at all. Just like, you know. So anyway, I'll get you the name of that book, Lori, but yeah, Moncrief is well known in the literature. Yeah.
Yeah, I never heard his name before, but it certainly made sense to me when I heard that was a myth,
Mhm.
that there's a chemical imbalance. However, when there is like you might say a critical mass of overthinking, that will change our chemistry.
Yes,
That's
exactly.
why we feel when we're anxious, we
Yep.
get the adrenaline rush and all
Yep.
of that, right?
And there's a lot of good reasons. Like if you get hit by a car and both of your legs have been chopped off and you're bleeding, you really do need acute medical care to stop it. That's not made up, quote unquote, right? And if you're having a psychiatric break and you're ill and you're like in la la land and you're running around naked, you need to get into an emergency room and get some medication. No doubt about it. There's no there are some things that need medical intervention, but that doesn't mean that that person's brain will never heal itself or that person, you know what I mean? Like there's been an over reliance on something that's not necessary. Yeah.
Oh, and the documentary called Medicating Normal.
Yeah.
I really recommend everybody have a look at that. It is, you saw that, right, Wendy?
Yeah.
Medicating Normal. Ah, wow,
Yeah. Powerful.
very powerful.
Yeah. About soldiers with like battle scars, right? And then they were put on these medications and they couldn't come off of them and it just changed their relationship with their families and it was and the you know TLC and time and you know going out in the woods would have been much more effective to get them back on their pins rather than medicating them with things that cause their bodies to go a little haywire. But yeah, it was painful to watch that. Medicating Normal.
Is that a
Painful.
movie? Documentary?
The
Yeah,
documentary. Mhm.
Wow.
I think it's on YouTube, I think.
I think so. Yeah.
But Medicating Normal, yeah, it's really it's heartrending.
Wow. Gloria, that degree is the equivalent of an MD, the one that something BBS that was in
I
the,
looked it up.
yeah,
That's the UK equivalent of an MD.
yeah.
Well, that's interesting. What do the letters stand for? I'm
It's
just curious.
the wording is bachelor something. MBBS, Bachelor of Medicine, Bachelor of Surgery, undergraduate medical degree equivalent to an MD in the US, 5 to 6 years
Wow.
in the UK and India.
Oh, interesting. Yeah. Wow.
Yeah, I'll have to check out that medicating normal. When you said those words, medicating normal, it made me think of kids who just need to run around, and
Yeah.
we don't have a run around world. We have, even when there are activities that you send a kid to, a lot of it is standing and listening and not running, running, running.
Really?
Mm,
Oh,
yeah.
Yeah, Mary, it is on YouTube. I'll put it in the chat right now if you want to copy it out of the chat. You don't have to, but
Well, I'm on my laptop.